size of the Priory organisation is that it's small enough that you can make a difference, but it's big enough to offer lots of opportunities.
At the Priory, you are the nurse, you're not doing everything, you know, so you get to be a proper nurse, I'd like to say.
The biggest drive why I wake up every morning and go to work is to try and make a difference in our safe users' lives.
Everyone's one big team, even though they're all different hospitals, you've always got someone to talk to about anything, advice. It's just really supportive.
They become more than just sort of colleagues you're working alongside. You generally have a sense of sort of a caring feel for them and making sure that everyone's all right.
And it helps to have fellow passionate people working with you who feel the same way that you do about eating disorders.
There's no typical day. Every day is always different. My day tends to sort of follow, you know, you start at 7:30 in the morning, you'll have a handover from the night staff.
Reviewing of care plans, risk assessments, doing one-to-one sessions with patients.
There's a real variety of clients on the unit, so every day is completely different.
There's always new people to meet, there's always new people to make feel welcome. There are challenging days. There are days where you have to do things that you probably never thought about doing before, like restraining and having to feed that way. That's always difficult the first few times.
When somebody asks, how do you think they will be in 3 months' time, I can never give that answer. That probably is the biggest challenge that I have faced as a nurse in neuro field.
Even though you're working with adolescents with mental health difficulties, you're also working with teenagers as well, so that's another challenge.
It's not always smooth sailing. At times, you don't feel like you've accomplished much, but then there are days where you walk away feeling like you've done the best that you could have possibly done that day. And it's a really overwhelming feeling, actually. You know that you're making a difference to people's lives.
I joined Priory probably some 19 years ago now, and I joined as a staff nurse at the Priory Hospital Woking. After having been at Priory for a little while, one of the things I realised about the organisation was that there was real opportunities to influence my department, so I could influence the ward, I could influence the hospital, I could influence the division, I could influence the greater organisation.
I definitely think the Priory is somewhere that can support you in reaching your goals.
They've been helping me with my pre-mentorship that I'm currently applying for, which means I can pass on my knowledge to other student nurses.
I've held 5 different roles within the Priory. You don't remain stagnant. There's opportunities for you to move up the ladder if that's your ambition.
I never thought that I would get where I am at the moment. In my 10 years at the Priory, I've never come across a situation where anybody has not been given an equal opportunity like anyone else.
I think if you're definitely wanting to progress your career and work, you know, with a really close team, then it's a place to be.
I definitely think you've got to be a good team player.
You have to have the passion and the love to do it.
You also need to ask yourself if you're prepared to see people at their lowest.
You've got to want to be in nursing and you've got to want to do the job.
I think skills and knowledge are very, very important, but I think there's nothing more important than compassion. If you've got compassionate, respectful care that's being delivered, I think that's the most important thing from a nursing perspective.